Good morning, everyone. My name is Okoinche Precious Onyeme, paramedic instructor, Delta State College of Health Technology, Health Safety Environmental Officer. I'm here to speak on a topic: who is a paramedic? Now, who is a paramedic? A paramedic is a healthcare professional who works in an emergency medical situations. A paramedic may be more formally defined as a medical professional who provides medical care to sustain life in the pre-hospital environment, usually in an emergency at the point of illness or injury. This includes an initial assessment of the patient after a particular health crisis. Treatment can also be continued en route to hospital if more definitive care for the patient is required. Paramedics provide advanced levels of care for the medical emergencies. In trauma, the majority of paramedics are based in the field, in ambulances, emergency response vehicles, or in specialist mobile units such as cycle response. Paramedics provide out-of-hospital treatment and minor diagnostic services, although some may undertake hospital-based roles, such as in the treatment of injuries. Now, training of paramedics. In the United States, paramedic training is considered vocational. Paramedic education programs typically follow the U.S. Department of Transportation's Emergency Medical Technician Paramedic National Standard Curriculum, while many regional accredited colleges and universities offer paramedic programs. Only a handful required a formal degree component prior to the completion. Courses minimum required hours vary from state to state, but range between 700 to at least 1,300 didactic and clinical hours. Now, we move straight to who do paramedics do, or what do paramedics do, or what is their employment structure presently in Nigeria and the world at large. I'm going to stress on that. Paramedics are employed by a variety of different organizations, and the services provided by paramedics may occur under different or differing organizational structures, depending on the part of the world. A new and evolving role for paramedics involves the expansion of their practice into the provision of relatively basic primary health care and assessment service. Some paramedics have begun to specialize their practice, frequently in association with the environment in which they will work. Some early examples of this involved aviation medicine and the use of helicopters and the transfer of critical care patients between facilities. Now, some jurisdictions still use physicians, nurses, and technicians for transporting patients. Increasingly, this role falls to specialized senior and experienced paramedics. Other areas of specialization include such roles as tactical paramedics, working in police units, marine paramedics, hazardous materials, heavy urban search and rescue, and paramedics on offshore oil platforms, oil and mineral exploration teams, and in the military. But in Nigeria, the profession is quite new. Some agencies haven't keyed into this, except Lagos State Emergency Management Agency, which is LASEMA, who actually have employed the graduates from the Institution of Health Technology UBTH, and likewise University of Benin Teaching Hospital also. But presently, UBTH got trained paramedic working in hospital instead of out of hospital. The Nigerian factor, they are actually not aware of its importance. Now we have some paramedics working in Delta State College of Health Technology as an instructor. Now, we have skills of paramedics in the hospital setting. It will interest you or interest Nigerians to note the following. While there are varying degrees of training and expectations around the world, a general set of skills shared by essentially all paramedics and EMTs, which is emergency medical technicians, includes advanced cardiac life support or ACLS, treats areas involving cardiac injury or compromise, the most common in cardiac arrest. Since the heart and nervous system begin to degrade in as little as 4 to 6 minutes, early recognition and treatment in the hospital or pre-hospital settlement, using many device and treatment modalities such as cardiac monitors, defibrillators, and cardiac medications. The chief objective is to stop and reverse the effects of lack of cardiac output. Spinal injury management, including immobilization and safe transport. Fracture management, including assessment, splinting, and use of traction splints where appropriate. Talking about obstetrics, obstetrics assessment includes assisting with uncomplicated childbirth and recognition of and procedures for obstetrical emergencies, such as breech presentation, cord presentation, and placenta abruption. Management of burns, including in classification, estimate of surface area, recognition of more serious burns, and treatment. Advanced airway management techniques, including surgical airways, triage of patient in a mass casualty incident, assessment and evaluation of general incident scene safety, effective verbal and written reporting skills, charting, routine medical equipment maintenance procedures, routine radio operating procedures, emergency vehicle operations. Now, medications administered by paramedics. Paramedics is most jurisdictions administer a variety of emergency medications. The specific medications they are permitted to administer vary widely based on local standard of care and legal restrictions and physician or medical director preference. For an acute description of permitted drugs or procedures in a given location, it is necessary to contact that jurisdiction directly. A representative list of medications may commonly include analgesics such as aspirin, ketorolac, and paracetamol, used to relieve pain or decrease nausea and vomiting. We have narcotics like morphine, petidine, fentanyl, used to treat severe pain such as with burns and fractures. We have adenosine, calcium channel blockers, diltiazem, and verapamil, used to slow down excessively high heart rates. We have a parasympathetic drug, used to slow down excessively high heart rates. We have a parasympathetic drug such as atropine or atropine, used to speed up slow bradycardial heart rates. We have norepinephrine. We have epinephrine, used for severe hypotension, which is low blood pressure. We have cardiogenic shock and septicemia. We have 50% D-water, a solution of 50% dextrose in water, used to treat hypoglycemia, low blood sugar. We have sedatives like midazolam, lorazepam, and etomidate, used to reduce the irritability or agitation of patients. Now, for clarity's sake, based on history and on the realities on ground in Nigeria, paramedics are pre-hospital in function. They are community, district, or state-based. They perform some procedures that physicians are supposed to do if their workload allows. According to the Britannica, these paramedic workers perform routine diagnostic procedures such as the taking of blood samples and therapeutic procedures such as administering injections or suturing wounds. They also relieve physicians of making routine health assessments and taking medical histories. Finally, I call on all comrades across the nation to stand their ground on the paramedic profession, to improve and modernize medical practice and not to be subdued by it, while we also inform and educate the people. I won't end this without mentioning or greeting my fellow colleagues in Nigeria. Long live paramedics. Please subscribe to Bright Amen YouTube channel and like and watch. Thank you very much.